patients with cancer are more susceptible to infection than individuals without cancer because malignancy and anti-cancer therapies result in an immunosuppressive state. And during the COVID-19 pandemic, several factors could account for an elevated risk for acquiring COVID-19 and consequent complications amongst cancer patients. These factors include frequent hospital visits and admissions, immune-compromised state, poor functional status, advanced age. That's why cancer patients feel afraid and stressed. Recently, several measures have been taken by the Emirates Oncology Society after conducting research on the practical approach to the management of cancer patients during COVID-19 to maintain the health of cancer patients, putting various aspects and factors into consideration. There are some measures to reduce the possibility of infection transmission at in-outpatient clinics. Ambulatory care clinics, including chemotherapy infusion units, will have strict screening and be prepared to identify and transfer potential cases safely without risking disease transmission. Entry-exit points will be reduced, with signage and personnel at these ports to facilitate communication and policy adherence. Clear communication and education about hand hygiene, infection control measures, the signs and symptoms of COVID-19, high-risk travel or exposure, and the importance of reporting new symptoms to the healthcare workers should be reinforced. There are also measures to reduce exposure risk. Telemedicine will be considered to support patients remotely to reduce in-person hospital visits during an infectious pandemic. The chemotherapy infusion unit will function at usual capacity to avoid cancer treatment delays. The patient will be contacted the day before their scheduled appointment to screen for any recent travel and contact history, as well as the possible development of symptoms associated with COVID-19. And in a worst-case scenario of a confirmed infection, patients with suspected COVID-19 infection will be admitted first to an isolation room as per standard infection control protocol. Grouped areas with minimization of staff overlap with other patient care areas will ideally be available for confirmed COVID-19 cases. The ultimate goal is the comprehensive protection of cancer patients and protecting them against the COVID-19 pandemic.